Hello, welcome back. Thank you for watching my channel. My name is Heather Graham, and today we are going to work on the shoulder sideline. We're going to do some shoulder mobilization techniques, some stretching. And to begin with, I like to take my loose fist and contour it just starting anterior to the upper trap, right there is that line of the upper trap. Sink my loose fist in and follow it posteriorly along those posterior cervicals. You can also take a nice stretch, taking both hands and coming straight down the top of the shoulder and finding that supraspinatus right between the neck and the shoulder. Right there is that nice supraspinatus muscle that lifts the arm, one of the rotator cuff muscles. And this is a really great way to work into those fibers with some friction, some circular friction. And you want to check in with your client, make sure the pressure is perfect at a hurt so good level, not too much pressure where the body wants to brace. And so we can just work this with little friction and stretching. So now this is also a great way to work the arm. You can do some general warming on the arm, getting up to the deltoids. This is a really great position to work on the deltoids as well because you can access the posterior, in the middle, and the anterior. And then I like to sit with my leg bent up and my hip next to my client's hip to give them some support. Place the arm between the hips so that their arm doesn't flop, and then you can access that shoulder from both sides. And I can take my fingers right up here underneath that medial scapular border and just rolling the shoulder backwards. My fingers will sit right up underneath that scapula. And then with my other hand, I've got the front of the shoulder, and then I can just gently rock by just moving the front, the back of the shoulder at the same time, and doing some nice friction around the front on the pecs and around the back, the rhomboids and the scapular region. So stretching and nice effleurage. Again, some layering friction on the posterior deltoid, moving to the middle and then to the anterior deltoid. So you can see that's a really nice position. Here we have the arm straight out to the side. You're going to put a bend in the elbow and hook their hand right behind their back. Take your footward hand and slide it right underneath their elbow and right around to grasp the front of the shoulder. You want to make sure their arm is nice and relaxed. Then you're going to take your headward hand and you're going to place it up underneath that scapula in the back. And then you can take and stretch the shoulder towards you and push the arm, the forearm, towards their hip. So you're doing a kind of oppositional stretch here. And with your headward hand, you can scoop down underneath that scapular border while you stretch the front of that shoulder back. And now we're going to take that arm and after some nice effleurage, we're going to stretch it out So now you're going to take that arm behind them, stretch that arm down, externally rotate the arm, and then bring it back till they feel a nice comfortable stretch. Place your headward hand or forearm right into that spot in front of their shoulder. So you're pressing down with your forearm, proximal fifth region, and with your other hand, you're pushing the hip in the opposite direction. Now we bring that arm further towards her head, upwards above her head, and then I can push the hips in the opposite direction. So we're giving her a bit of a spinal twist, as well as a nice, gentle, slow stretch along that entire right side of the body. And then you want to internally rotate the arm, put a bend in it, support it down or above her head, and then take your opposite elbow. And here, you're going to sink in to this region right below and lateral to the armpit. So you're going to be hitting some teres minor. You're going to be hitting a little bit of definitely serratus and serratus anterior and some of the latissimus dorsi. So just sinking down and moving slightly down. I can move with a little bit of friction if I want and just get into all of those muscles that really there is no other way to access besides this side lying position. This really is a great and versatile way to work on the shoulder. And I give a little traction, nice stretch, and then put a bend in the arm and bring the arm back down by their side. And here, I'm going to show you some nice arm work. So you can take and pinch those extensors and just kind of pick that muscle up and squeeze with your fingers and your thumb, between your fingers and your thumb. And just give a nice squeeze and roll, just waiting for those muscles to release. So again, lifting up, pulling the muscle away, squeezing the muscle, and now going with some nice effleurage. I like to pin the hand on the hip and perform my strokes with the arm nice and stabilized. And again, we can take and do some lifting petrissage, squeezing in the upper arm, and especially that deltoid area. It lends itself beautifully to some pincing and effleurage and some petrissage. So you can get all aspects of the arm, including the hand, from this position as well. A nice traction, pulling the hand, doing some finger pulls. So thank you for watching. And go ahead and try some side lying with your clients. It really does make your massage a lot more fun to have a different canvas to work with.